Welcome to Effectively Partnering with Rural Communities for Public Health Communications course. My name is Esmeralda Salas, and I am a research associate with the Population Health Innovation Lab, a program of the Public Health Institute. Thank you for being here today. I'm excited to guide you through today's lesson and explore the content together. Before we get started, I want to share a few important acknowledgments and disclosures. This course was developed with support from the Centers for Disease Control and Prevention, Office of Rural Health, through funding provided under CDC RFA PW 240080. CDC, along with their planners and content experts, would like to disclose that we have no financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Additionally, the content in this course will not include any discussion of products for unlabeled use or products under investigational use. Finally, CDC did not accept any financial or in-kind support from any ineligible company for this continuing education activity. With that context in mind, let's talk about who this course is designed for. This course is designed for individuals who may not directly work in rural settings, but are involved in rural public health and seek to deepen their understanding of collaborating with rural communities to enhance public health communication strategies. For example, participants may include federal level or state level public health staff developing communication campaigns or policies that impact rural populations, nonprofit program managers supporting rural health initiatives, hospital system outreach coordinators working with rural communities, consultants providing strategic support to rural clinics and health departments, nurses working in rural communities, and many others. Now that we've identified who this course is for, let's look at its purpose. This course seeks to deepen participants' understanding of how to effectively partner with rural communities to enhance public health communication strategies by focusing on building relationships with rural communities, planning, developing, and disseminating tailored public health messaging for rural audiences, and collaborating with community partners throughout the communications process. So how will we achieve these goals? The course features a combination of practical tools and real-world insights. You can expect strategies and resources. You'll find tools and approaches you can use to support your public health communication efforts. You'll also find real-world examples. Throughout the lessons, we've included scenarios and stories drawn from rural communities to help illustrate various concepts and strategies. You'll also find insights gathered from rural health community members and experts. You'll hear directly from those doing the work, such as rural health community representatives, public health practitioners, rural experts, and other experts whose experiences shape this course. Their voices, gathered through a series of interviews, are highlighted throughout the lessons to deepen your understanding of partnering with rural communities. You can also expect integrated workbook activities. At the end of each lesson, we'll guide you through activities from an accompanying workbook. These activities are designed to help you reflect, plan, and apply what you're learning in a way that's relevant to your work. This course is structured into 4 lessons. Lesson 1 lays the foundation by exploring the importance of collaborating with rural communities. Participants will learn why these partnerships matter and how to practice active listening and relationship building to foster trust and more effective communication. Lesson 2 focuses on co-developing a public health communication strategy with rural communities. Learners will walk away understanding the core steps of strategic communications, how to assess community needs and assets collaboratively, and why rural voices are essential in the planning process. Lesson 3 dives into developing public health messaging that resonates with rural audiences. Participants will learn how to craft linguistically and contextually responsive messages, and how to meaningfully involve community members in message development to address community health and resilience needs. Lesson 4 closes out the course with strategies for dissemination. Participants will identify ways to share public health messages with rural communities, such as ways that build on local leadership, or promote informed decision-making, and ultimately contribute to better health outcomes. Today, we'll be jumping into Lesson 1, Building Relationships. In this lesson, we will explore how building relationships with rural communities can strengthen and ultimately enhance your public health communication efforts. By the end of lesson 1, you will be able to recognize reasons why collaborating with rural communities is important for effective rural public health communications, identify strategies for active listening to strengthen collaboration with rural communities, and lastly, you will be able to identify strategies to support building relationships with partners to improve public health communication. Here is how we will get there today. To begin, we will start with an introduction to rural public health, aligning on a shared definition, why rural public health matters, and key goals and recommendations when conducting work in rural communities. From there, we will lay the groundwork for identifying community partners who can contribute to the creating and supporting of the planning, development, and dissemination of rural public health communications. Next, we will highlight 2 examples from the field that illustrate why relationship building in collaboration with rural community partners are so important. After that, we will spend some time diving deeper into specific strategies and tailored resources for building relationships. Finally, we will conclude our lesson by connecting these key concepts to the activities and tools included in your course workbook, giving you an opportunity to apply what you've learned in a practical and actionable way. Before we move into the main content of this lesson, let's take a moment to pause and reflect on a few questions to get us thinking. Think about a previous public health communications initiative where community involvement was prioritized. What strengths or values stood out to you in that community? How did community involvement influence the communication approach? Now consider a rural public health communications initiative you may work on in the future. Why do you think it's important to go beyond simply communicating to rural communities and instead partner with them in creating public health messages? Press pause and take a moment to think through these questions. When you're ready to continue, press play and we'll continue with the lesson. This course focuses on rural public health communications. However, what do we mean when we talk about rural public health? Let's start with the shared understanding of what we mean when we're saying rural public health. As stated by the CDC Office of Rural Health, rural public health is the science and practice of preventing disease, prolonging life, and promoting health and well-being in rural communities. Rural public health seeks to protect the health of communities and works with rural healthcare systems to improve the overall quality of life for every individual. Rural public health is more than just delivering healthcare in rural areas. It's the science and practice of preventing disease, promoting health, and improving well-being across entire communities. As defined by the CDC Office of Rural Health, rural public health works hand in hand with rural healthcare systems to improve the quality of life for everyone and not just those who walk through clinic doors. Often, people wonder what the difference is between public health and healthcare. The distinction between public health and healthcare is important. While healthcare typically focuses on treating individuals when they're sick or injured, public health looks upstream. It looks at the broader factors that shape health in the first place, such as clean air and water, housing, access to food, community safety, and more. In rural communities, this work often looks different. There may be fewer formal systems in place, but deeper relationships and trusted community networks that play a vital role in protecting and promoting health. As highlighted in the Institute of Medicine's report, The Future of Public Health in the 21st Century, public health is not the responsibility of health departments alone. It takes a wide range of actors: schools, businesses, local government, media, and community organizations, all working together. In rural settings, this interconnectedness isn't just helpful, it's essential. So as we move through this course, we invite you to keep this broader view of rural public health in mind. Whether you're coming from a policy, healthcare, nonprofit, communications background, or other, your role contributes to this bigger system of care that supports the health of rural communities. Why is rural public health an important area of focus? According to CDC's Office of Rural Health, tens of millions of people live in rural communities comprised of vast and varied landscapes, inclusive of geographically isolated frontier and tribal lands, as well as U.S. territories and islands. Although the needs of rural communities vary, many face the same health challenges, such as high rates of obesity, high blood pressure, diabetes, smoking, and cancer, all of which can lead to poor health outcomes and even premature death. Many rural communities are applying innovative approaches to address their own health needs. Thus, understanding and supporting these community-driven rural health efforts is essential to advancing rural health and ensuring that rural communities have access to the resources and opportunities needed to address community health and resilience needs. To support this vision, the CDC Office of Rural Health has identified collaboration as one of its 5 core values to improving the health of rural communities. Specifically, the CDC emphasizes that collaboration should recognize and embrace the value of partnerships and relationships for addressing unique health challenges facing rural communities. Supporting this perspective, the Nork Walsh Center for Rural Health Analysis published a brief in 2018 highlighting that rural communities have remarkable strengths, assets, and rich cultures and histories that are often overlooked when developing strategies to improve rural health. The brief further outlined several key recommendations for state and national partners to engage rural communities, highlight strengths, and leverage assets to improve health. These recommendations include build relationships and trust with communities, identify and grow rural leaders, including youth, develop rural-specific communications and messaging, engage with regional and local organizations who understand local culture and past experiences, engage in continued rural learning. Building on these insights, the CDC Office of Rural Health 2024 Strategic Plan outlines several objectives in key priority 1 relevant to this course. This includes Objective 1, strengthen partnerships to improve rural public health functions, services, and delivery. Objective 2, expand rural outreach and engagement among state, tribal, local, and territorial public health and rural partner organizations. Objective 3, develop and disseminate clear, consistent, and timely scientific, educational, and communication resources tailored to rural public health needs. Taken together, both the Nork Walsh Center for Rural Analysis report and CDC's Rural Public Health Strategic Plan highlight that partnering with rural communities and creating rural-specific communication initiatives are a priority when developing initiatives to improve rural public health outcomes. In lessons 2 through 4, we'll dive into more detail about how to create rural public health communication strategies, develop messaging, and disseminate messaging in collaboration with rural community partners. But before we get into those specifics, the first and most critical step is building relationships with community partners. So let's jump in. We will start our conversation on building relationships by first talking about identifying community partners. For the purposes of this course, we have chosen to use the term partners to include both rural community and organizational representatives. In other words, a partner is essentially any person or organization who has an interest or concern in this rural public health communications initiative and can contribute to the creating and supporting of the planning, development, and dissemination. We have intentionally framed the term this way to avoid othering and highlight the value of both community residents and organizations in the collaborative decision-making process. This reflects our commitment to community-rooted approaches. Zachary Ray, a rural public health partner, explained the importance of this approach. You have to go into those communities, and you have to learn about them. You have to be curious, you have to be respectful, and you have to want to help everybody in a community, not just the ones that walk through your door, not just the ones that look like you, but to the entire community. So, how do we identify these community partners? To guide this process, consider the following questions. Who are the community members, residents, and/or representatives of local organizations who have a stake in the issue or initiative? Who are the intended recipients or audiences of your communication efforts? Who are the individuals, groups, or institutions with a vested interest, either supported or oppositional, in the success of the communications initiative? Who are the trusted local voices or subject matter experts within the community? Who may shape or affect how the message is received, or how the initiative is implemented, including supportive partners and potential skeptics or naysayers. Who holds formal or informal power to influence decision making or public opinion? What communication channels do these individuals or groups regularly use and trust? For example, is it local radio, faith-based networks, tribal councils, social media? For innovative and grounded results, it's important to think beyond traditional partners as well. Ensure that both the messengers and decision makers are invited, as well as those who work in relevant fields and are closest to the action of the issues at hand. This could include on-the-ground partners, practitioners, program staff, service providers, and field staff. Invite people whose lives are impacted by the outcome of this project, for example, parents and young people, to bring their voice to this context so their perspectives shape the process. Ask, who isn't here? And take steps to identify and engage those whose voices are often left out but are essential to equitable and effective solutions. Nancy Etch, an infection prevention coordinator at Central District Health Department, also emphasized the importance of including different perspectives when partnering with rural communities. Rural communities are diverse, but unfortunately, many people in these communities may not have a voice. So, looking at rural health communications, we need to get to older adults, school-age children, people of color, and people who speak English as a second language. Definitely. Finally, to support this process, check out the Potential Partners Brainstorm tool from Healthy People 2020. This resource provides a helpful starting point for identifying who you may want to include as a potential partner in a public health communications initiative. Partners can come from the health sector, community and volunteer organizations, community populations, businesses, and more. To illustrate this in practice, we will now explore an example from the field. The Schoharie County ACEs team in rural New York. This case study, published by the Rural Health Information Hub, highlights the importance of partnering with community organizations across sectors to develop a successful communications initiative focused on community education and training. You can read the full version on our RHI Hub website. Before diving into the field example, let's quickly review the definition of ACEs and importance of ACEs prevention initiatives. This will help us better understand the impact of community partnership in these efforts. Adverse childhood experiences, ACEs, are potentially traumatic events that occur in childhood. ACEs can include violence, abuse, and growing up in a family with mental health or substance use problems. Toxic stress from ACEs can change brain development and affect how the body responds to stress. ACEs are linked to chronic health problems, mental illness, and substance misuse in adulthood. However, ACEs can be prevented. Preventing ACEs can help children and adults thrive. It potentially lower risk for conditions like depression, asthma, cancer, and diabetes in adulthood. It could also reduce risky behaviors like smoking and heavy drinking. Additionally, it can improve education and employment potential, and it can stop ACEs from being passed from one generation to the next. Raising awareness about ACEs can help change how people think about the causes of ACEs and who could help prevent them. It could shift the focus from individual responsibility to community solutions. It can help reduce stigma around seeking help with parenting challenges or for substance misuse, depression, or suicidal thoughts. It could also help promote safe, stable, nurturing relationships and environments where children live, learn, and play. With that context in mind, let's jump into the Schoharie County field example presented by RHI Hub. In rural Schoharie County, New York, local staff at human service agencies were concerned about widespread ACEs affecting children in the community. According to RHI Hub, the ACEs team invited several local agencies to participate in monthly meetings to organize and build resources, share information, discuss community needs, and plan community-wide ACEs-related educational events. As this initiative grew, the team continued to focus on building strong relationships across community sectors. The team now includes a wide range of partners representing schools, health departments, mental health services, community-based organizations, and other sectors to collectively plan and deliver community-based education and trauma-informed care training. This example from the field demonstrates how collaboration across sectors can help address complex rural public health challenges by pooling resources, expertise, and community insights. Most importantly, the Schoharie County ACES team not only values involving various stakeholders and valuing community expertise, but it also prioritizes creating accessible educational content and hosting impactful events. As of 2024, the team has hosted 8 annual ACES educational conferences. RHI Hub describes how, initially, the ACES team targeted early childhood development professionals and parents. Since the conversation around ACES is growing, the event's focuses have expanded to include all community members. In addition, the team provides shorter trainings to groups and professional settings, including schools and police departments. They've also created resource bags for families raising children exposed to trauma. Bags include resources and practical strategies in addition to ACES information. Through these efforts, the Schoharie County ACES team has seen many successes as a result of building strong relationships with partners across multiple sectors in the county when developing their communications initiatives. Here are a few examples of the initiative's positive outcomes and community impact. Strengthened multi-sector partnerships and created an ACES model for other counties in the state interested in starting this work. They reached hundreds of attendings through conferences and trainings. They've improved trauma-informed understanding and practices across public services. RHI Hub shares that the program has seen an increase across systems in the use of common language and a common understanding of childhood trauma. Schoharie County Head Start has begun distributing the ACES questionnaire and the Resilience questionnaire to families who have experienced ACEs and followed up with discussion about their scores. After attending an ACEs training, the Cobleskill Police Department implemented a new policy that requires the department to contact the school district counselor if a child has been present during a police call. That way, the child's school will be informed and can provide support. The Schoharie County Plan also includes goals around addressing ACEs in the community. Now let's pause and reflect. Think back on what we've covered so far in Lesson 1 and consider the following questions. Take a few minutes to reflect on a rural public health issue you're working on. Who are some of the non-traditional partners that you could collaborate with in the rural community to improve outreach and communication in the rural community? What value could these bring to your initiative? And just as importantly, what could you learn from them? Press pause and take a moment to think through these questions. When you're ready to continue, press play and we'll move on to the next section of our lesson. Now let's explore this example of a communications initiative developed by the Idaho Department of Health and Welfare and several partners focusing on recreational lead exposure. According to the CDC, lead is a naturally occurring metal that can cause harmful health effects. People may be exposed to lead by eating paint chips, consuming contaminated food or water, or inhaling lead dust. This example highlights the importance of working with a variety of partners who understand rural contexts to consider the audience's values and practices when developing a public health communication strategy. Details of this initiative were published in the ASTO 2023 report on supporting resilience in rural areas through cross-sector partnerships, and as a case study titled Idaho Department of Health and Welfare Addresses Recreational Lead Exposures. Let's first consider the context for this communications initiative. In 2020, the Idaho Department of Health and Welfare launched an educational resource campaign focused on sharing communication materials with the public to address gaps in messaging and awareness about the risk of recreational lead exposures. It's important to understand the local context. Idaho has a long history of mining and industrial smelting operations. As a result, soil, sediment, groundwater, and surface water near many mining sites can be contaminated with lead and other heavy metals. The ASTO report describes that over 60% of Idaho is public land, and this land is often used for recreational activities such as hunting, driving all-terrain vehicles, and shooting at outdoor gun ranges. Given the popularity of these activities, Both children and adults can be at risk of lead exposure due to contaminated lead in soil, dust, and ammunitions. Recognizing that lead exposure rates were disproportionately higher in rural communities, the Idaho Department of Health and Welfare focused on developing tailored messaging and dissemination strategies for these areas. To achieve this, the Idaho Department of Health and Welfare took a tailored approach to engage a variety of partners in the development of the Educational Resource Campaign. The Idaho Department of Health and Welfare collaborated across sectors with a combination of community, state, and federal partners on this initiative, including local public health districts, hunting and shooting organizations, Boise State University, Boy Scouts of America, Idaho Department of Environment, Idaho Department of Fish and Wildlife, and the U.S. Bureau of Land Management. The ASTO report describes how, through its partnerships, the Idaho Department of Health and Welfare developed a series of fact sheets on recreational sources of lead, including wild game meat, bullet reloading, indoor gun ranges, and outdoor gun ranges. Since developing these fact sheets, Idaho Department of Health and Welfare has been working to share these with stakeholders and raise awareness about lead poisoning across communities in the state. Flyers and videos were created in English and Spanish on the Idaho Department of Health and Welfare website for a variety of recreational settings where people may be exposed to lead. Each resource focuses on a different setting and audience of focus. In addition to resources created for hunters in various settings, additional materials were created for gardeners, antique buyers, and others. With this field example in mind, let's take a moment to pause and reflect. Think of a rural community you worked with or are familiar with. What are some of the most important values or practices in that community? How were they reflected or ignored in previous public health efforts? Press pause and take a moment to think through these questions. When you're ready to continue, press play and we'll move on to the next section of the lesson. Now that we've reviewed examples from the field, let's shift our focus to strategies and resources you can use for building relationships with rural community partners. One valuable resource that highlights effective partnership practices is the ASTO report on supporting resilience in rural areas through cross-sector partnerships. The report emphasizes that public health professionals that engage rural partners in decision-making throughout the course of any partnership can strengthen the impact of that partnership and ensure it fits the needs and unique considerations of that community. The report highlights several key considerations for partnership, including trust, humility, understanding, shared goals, commitment to equity, contextualizing health equity, language, engagement, peer-to-peer sharing platform, tailored support, and creating a logic model. While it covers many areas, today we will focus on 3 considerations for partnerships. We will be focusing on trust, humility, and understanding. Let's start with trust. Building trust takes time and effort. Invest in relationship building activities such as regular communication and face-to-face meetings. Prioritize active listening to identify common goals and values and to establish a foundation of trust and mutual respect. Next is humility. Approach collaboration with humility. Members and leaders of rural communities have helpful expertise and can offer valuable perspectives. It is important for non-rural partners to acknowledge this expertise and honor the lived experience of local community members. Finally, understanding is essential. Understand the core values of community partners, whether it is an emphasis on strong family support systems, close-knit sense of community, pride in self and family, self-reliance, independence, and work ethic, or the importance of justice, loyalty, and faith. The core values of each community may look a little different, so it is important to approach each engagement with an open mind. Building on these principles, the Tamarick Institute's article, Trust, an Essential Ingredient in Authentic Community Engagement, offers 5 recommendations for how to authentically engage and build trust with community. Let's take a closer look at each recommendation and explore how they can guide meaningful community engagement. To start, The Tamarick Institute emphasizes the importance of being clear about the purpose behind your engagement. Trust is broken when we are not clear about the intent behind our engagement. Ask yourself, why are you engaging? Is it to inform people of a decision that's already been made? To ask for ideas about how to solve a problem? To invite collaboration in solving a problem? Being clear about your purpose helps establish realistic expectations for your engagement. Building on the idea of clarity, it's important to remember that community engagement isn't just about gathering input. The Tamarick Institute highlights that, beyond obtaining input to inform our organization decisions, community engagement can also be an important strategy to establish and strengthen relationships with those we serve. Engagement can also help build capacity in residents and communities by sharing knowledge and empowering local groups, which ultimately fosters citizen leadership and a community's resilience. Next, let's consider the importance of closing the loop. According to the Tamarick Institute, community engagement is often an activity that happens off the side of our desk, rather than a core ongoing strategy for how an organization operates. Frequently, once the community engagement effort provides the organization with what it needs, focus shifts to how to use information for our own decisions. Not taking the time to circle back and let those that were engaged know what conclusions were drawn from their input or how that input is being used contributes to the community's cynicism and lack of trust that their perspectives were heard and valued. With that in mind, the next recommendation is to value the wisdom of both content and content experts. The Tamarick Institute describes how, as professionals, we place significant value on the subject matter knowledge of content experts. There is, however, another form of expertise that is equally essential when working in community: the knowledge of the content expert, the resident who has first-hand experience of the issue within our community. Because communities are unique and dynamic, the wisdom of the content expert is essential in designing effective place-based solutions. Finally, community engagement should be creative and fun. The Tamarick Institute notes, when designing your community engagement strategy, remember that you're competing for people's time and attention. Make your outreach and engagement efforts inviting and enjoyable. For example, use interactive activities, storytelling, or informal settings. Use creative communication tools like video, vibrant visuals, or playful language to make your invitation stand out. The Tamarick Institute highlights the value of using engaging, visually appealing content to spark interest and increase participation. A skill that ties all this together is active listening. Active listening is a communication skill that helps build trust, demonstrate respect, and uncover insights that would otherwise go unspoken. In rural public health work, it's a practice of slowing down and focusing on understanding the speaker's reality. A rural public health partner, Alana Knudsen, shared this story. A public health faculty member took her MPH students to a rural North Carolina community with the high prevalence of type 2 diabetes. The students arrived eager to make a difference, ready to tackle A1C levels heads on. But during their listening sessions and focus groups, they learned the community's top concern wasn't diabetes, it was safety. Many streetlights were broken, leaving the neighborhoods dark at night. Residents felt unsafe going outside. The students were puzzled. "We came here to fix diabetes," they told their professor. She responded, "How will you gain their trust to address diabetes if their number one priority on the most basic level of Maslow's hierarchy is safety? Meet them where they are. Show them you're listening." The students took on the challenge, learning how to navigate local systems, secure small grants, and coordinate repairs. Once the street lights were restored, trust grew. Only then could they start meaningful conversations about diabetes and other health concerns. The lesson: lasting health change begins by meeting people where they are, listening to what matters most to them, and acting on it. When you start with their priorities, you build trust, and that trust opens the door to everything else. Some practical ways to practice active listening include Ask open-ended questions. For example, what are your concerns about this issue in your community? You can also reflect back what you've heard. Resist the urge to problem solve too quickly. Listen for values, not just facts. Listen for opportunities to build trust, others' need, and understand preferences and barriers. To deepen your listening skills, consider the 4 levels of listening framework. The 4 levels of listening framework identifies 4 levels of listening and talking: downloading, factual, empathetic, and generative. Let's review each of these further. Level 1, downloading. Downloading is the first level of listening where we seek information that confirms what we already know. Listening from habits. It's like skimming news to reinforce existing beliefs or quickly scanning instructions to validate that we know what we're doing. We aren't fully present in a conversation. Others can sense this lack of engagement, and a conversation can be unproductive, leaving the other person feeling ignored or disrespected. Level 2, factual. Factual listening is marked by the curiosity and attention to the content of the conversation. It helps us expand our knowledge, but it often separates the facts from the emotional and human aspects of the conversation. Factual listening involves noticing disconfirming data, seeking and verifying information that may challenge our assumptions. We may overlook nonverbal cues or emotional nuances, missing deeper insight into what's happening. Level 3, empathetic. Empathetic listening goes beyond facts to connect with the speaker emotionally. At this stage, we are attuned to what is being said and how the speaker feels. We try to see the situation through their eyes, leading to an emotional connection. This deeper listening helps us understand the speaker's perspective while allowing us for constructive challenges when necessary. This type of listening allows us to connect with others from within, using an open heart. Level 4, generative. Generative listening is the highest level, where the focus shifts from the present conversation to co-creating a vision for the future. At this stage, the listener and speaker explore emerging possibilities and solutions. The listener is fully present, without ego or preconceived notions, and is committed to helping bring the best possible future into being. There is a sense of energy that comes from this type of listening. By practicing these strategies, building trust, approaching with humility, understanding core values, engaging creatively, and listening deeply, you can strengthen partnerships in rural communities and achieve more meaningful outcomes. Before moving to our workbook activities, I want to highlight that several portions of today's Lesson 1 content were adapted from the Powering Change curriculum developed by the Population Health Innovation Lab. As we wrap up Lesson 1, let's shift from ideas into application. We're now going to review the related workbook activities, which are designed to help you apply what we've covered to your own work. Take a moment to locate the workbook. In the description below, you will find links to both the PDF version and a Microsoft Word version. Here's how to navigate the workbook. When you open the workbook, use the table of contents to move between lessons. For Lesson 1, you want to go to the section titled Setting a Foundation, Building Relationships with Rural Communities to Support Public Health Communications. The intent is that you complete these foundational activities before starting to work through the essential steps of strategic communications, which will be the focus of Lessons 2 through 4. So let's walk through the first activity together. The first activity is focused on identifying rural community partners. Here, you will respond to a set of guiding questions to help you map out the rural partners essential for your upcoming communications work. Feel free to jot down any partners that come to mind now, and remember you can add to this as you meet and learn from more partners later on. Now let's move on to the second foundational activity. This one focuses on active listening strategies. Here, you will review strategies listed in the table and take notes before, during, and after your meetings with rural partners. As you look at these strategies, think about which ones you already use and which ones you like to strengthen. These will help you build relationships, develop trust, and learn what is important for developing and implementing the upcoming public health communications initiative. These two foundational activities will set you up for building relationships. By completing them, you'll be well prepared to dive into the more detailed communications planning steps we'll explore in the next lessons. Please feel free to pause here and take a few minutes to begin working through the related activities. When you're ready to continue, press play and we'll move into the final part of our lesson. As we wrap up this lesson, let's take a moment to review what we've covered. During this lesson, we discussed the importance of rural health. We explored two examples from the field to better understand why partnering with rural community partners is important. And lastly, we took a deep dive into strategies and resources for building relationships with rural community partners. In lessons 2 through 4, we'll offer a roadmap for rural public health communications that is intentional, flexible, and centered on partnership with rural community members. Before we close, here are the references for the materials and resources we discussed throughout this lesson. In addition to the resources highlighted during the lesson, here are a few more we recommend you explore to help guide building relationships with rural communities to support public health communications if you wish to explore more deeply. Thank you for joining us today. If you have any questions or would like to stay connected, please reach out to us at info@pophealthinnovationlab.org or follow us on LinkedIn. We appreciate your time and we look forward to continuing this journey with you in the next lesson.